summer. With summer in full swing and much more time spent outdoors, doctors are reminding us to pay attention to our skin. Joining us now is Dr. Colin Buckley with Infirmary Surgical Specialists in Fairhope, here to talk about skin cancer, specifically melanoma. Thank you so much for being here for a very important conversation.
Thanks for having me.
Absolutely. So obviously very timely. We are in the middle of the dog days of summer right now. As we know, melanoma is the deadliest form of skin cancer. So let's start with the basics. What exactly is melanoma and what should people be looking out for?
Yeah, so melanoma is a type of skin cancer. It starts in the pigmented cells of the skin called the melanocytes. Melanoma is particularly concerning because while it's a less common type of skin cancer, it can be a lot more aggressive because it has the ability to spread to lymph nodes and even other organs. So the important thing to know would be that we want to catch it early. We want to be aware of melanoma because treatment options are much better for melanoma when it's caught early.
Sure. You know, here's a big question. How can someone tell if a mole or spot on their skin should be checked?
Yeah, it's a great question. One of the easiest things to remember is the ABCDE rule. So it's an acronym. A stands for asymmetry. So think of a mole that one half looks different than the other half. B is for borders, so think irregular or jagged borders. C is for color or color variation, so a mole that's black, blue, red, brown, multiple different colors. D is for diameter, so think a lesion that's bigger than the tip of a pencil eraser, but melanomas can certainly be smaller. E is for evolving, so think of a lesion that is, or a skin cancer looking thing that's changing in size, shape, color, or even behavior, like it's becoming itchy or bleeding.
Okay, interesting. Who is at most risk for melanoma and what can people do to prevent it?
So anyone can get melanoma. But there are some known risk factors. So people that are fair-skinned, light-colored eyes, many moles throughout their body, a history of multiple sunburns or frequent sunburns, tanning bed use is a big risk factor, or a family history of melanoma. So prevention is actually pretty straightforward. Wear sunscreen. You know, we're talking about the angels coming out to Pensacola. Everyone's gonna be on the beach. You gotta protect your skin. Protective clothing, hats, skin rated clothing that's gonna protect you from sunburns, at least SPF 30 sunscreen, and generally avoid tanning beds altogether.
Yeah, that's really good. I like how you said that it applies to pretty much every demographic of people. I will say back in high school, I got a freckle checked out, and I'm so glad I did. It was not melanoma at the time, but I think getting that conversation started with people of all ages is so, so important. If people are watching right now and they want to learn more from you or a member of your team or find those resources, how can they do that?
Well, you know, if you have a concerning skin mole that you're worried about, you know, it doesn't look like the others, or you have any concerns, you know, the first step would be to get checked out by your primary care physician or your dermatologist, and, you know, advocate for yourself and seek evaluation like you did.
Yeah, we really appreciate your insight, Dr. Buckley.